The outbreak of Ebola is covering a much broader area than previous ones and infecting more people. Big question now, why? I asked Dr. William Schaffner to give us his insight. He is chair of the Department of Preventive Medicine at Vanderbilt University Medical Center.
Yeah, the reason probably is that other outbreaks started small in little remote villages, and so they were much more contained. The virus this time has gotten into cities, and of course, with people much more mobile, moving around, it's spread much more readily, and now we have the largest outbreak on record.
Well, a lot has been made about one man who fell ill on a flight to Nigeria. The U.S. government has sent a health alert to U.S. doctors about the outbreak, and all ports of entry are on a so-called red alert. How contagious is Ebola, and could we see an outbreak in other parts of the world, or has it already spread?
Well, it's spread readily, but only to people who are in very, very close contact with an infected person. That is, healthcare workers who are dealing with body fluids all the time. And in Africa, after a person has died, the family members and friends who bathe the person, they are the ones who are going to get very, very sick. It's not spread very readily in a close approximation. In fact, if someone were in the incubation period and got on a plane and came to the United States, if I were sitting next to them, I would really not be very concerned at all because I'm not being exposed to that individual's body fluids directly.
We see a lot of backlash against the aid workers in the regions impacted by Ebola. In Sierra Leone, the family of one infected woman forcibly removed her from a hospital where she was being treated. The woman has since died. So how can medical workers get past the stigma to actually be able to treat these patients?
I think with smiling, compassion, compare, and try to give the best facts out, we can but do our best. There's a lot of superstition, a lot of misinformation, a lack of education, such that healthcare workers have a mixed reputation at the present time. They're trying to do good things, but they're from the outside, so they're mistrusted. In fact, some local people think the outside workers are bringing the illness with them because, of course, they entered the village or the area of the city when cases have occurred. So you can see how people who don't have a lot of education can draw the false conclusion.
And as we mentioned, once infected, Ebola is almost always fatal. Is there an age group that's more at risk than others? And what's the most promising course of treatment at this point?
Well, what we try to do is identify patients as early as possible so we can actually maintain them while their body fights the infection. But it is a frequently fatal infection. 60 to 70% of people are dying in this outbreak. And surely older persons, people with underlying illnesses, as with any infectious disease, are at the greatest risk of dying when they get infected.
All right, Dr. William Schaffner, chair of the Department of Preventive Medicine at Vanderbilt University. As always, we appreciate your time.
Thank you.